previous. Today we are going to discuss on the side determination of radius bone. So let's start. This is the radius bone, this is the upper end and this is the lower end, and in between there is an intervening shaft. This is the upper end. At the upper end there is a round disc shaped head. Below the head this is the neck, and below the neck this is the tuberosity, which is known as radial tuberosity. At the lower end, on the lateral side there is a stelloid process. This is the stelloid process at the lateral side of the lower end, and this is the dorsal tubercle of Lister. This is known as dorsal tubercle of Lister. This is on the posterior surface. This is posterior surface. This is anterior surface. So dorsal tubercle of Lister should be on the posterior surface. And there is a three borders: anterior border, posterior border and the medial border. For the side determination, we should be focus on the medial border, which is the sharpest border. This is the sharpest border. This is the medial border. It should be on the medial side. This is the radial tuberosity. It is also on the medial side. For the side determination, let's start. For the side determination, we keep these points on mind, that at the lower end, that is the dorsal tubercle of Lister, it should be on the posterior surface. This is the dorsal tubercle of Lister. This should be on the posterior surface. And sharpest border is the medial side. That this is the sharpest border should be on the medial side. And this is the upper end and the lower end. This is the upper end and this is the lower end. Upper end is disc shaped and this is the stelloid process, dorsal tubercle of Lister on the lower side. Let's start side determination of radius bone practically. This is the right hand, this is the left hand. Put the radius bone, this is the upper end, this is the lower end. Placing upper end at the lower end. So what is the criteria for the side determination? Sharpest border should be on the medial side. So this is the sharpest border should be on the medial side. But dorsal tubercle of Lister should be on the posterior surface. But as you can see, this is on the anterior surface. So this is not the bone of right hand side. So by placing same radius bone on the left hand side, and radius bone is on the side of thumb. So placing radius bone at the side of thumb, sharpest border should be on the medial side and dorsal tubercle of Lister should be on the posterior surface. So this is the dorsal tubercle of Lister. This is on the posterior surface and sharpest border is on the medial surface. So this is the bone of left hand side. Thank you.